Bro, like my God. Same. Yeah. We did. First time because I know they're a little bit. We call it a front. Whatever. Do you want to say yeah. I'll leave it up set up. I'm good to go whenever. I feel like we should. Yeah. I feel like because they're I don't know. I've learned that it's really hard to switch between like different modes of brain. I'm going from like like the time it takes me to like switch between those parts of my brain. It just like really strains my head. I don't know how. There needs to be a divide and like some time in between the zone A and zone B. I feel like I just started like a new role where I feel like during the day. During the day, I feel like walking really hard and like talking in a very corporate way, in a very formal way. And my roommate actually was like a letter and we just been like setting up like roommates and like but the way I've been like testing out the logistics, I feel like I'm like you know, like I can't even describe it, but I feel like I'm very much into like roles where and I'm just like doing logistics. And then like I feel like I operate the same time. It's like because you're like logistics, like oh let's set up a meeting and then like you invite or whatever. You go down there like regular pages. I did the same thing. And like super formal and I was like I'm a real person at yeah. Right. But you had everything. It was really sweet. It was really great. She's like only 22. You can take really I don't think we're going to be at all. Yeah, it would be just like a random.
friend said like you guys.
It might ensure that I have a master's.
She's like, I don't want to name this complicit institution. Are you sure?
Yeah. I'm like, no connection to college. No, yours is fine.
Yeah, yours makes sense. I mean, it's up to you. I could put went to Columbia, but denounces this institution. You feel it? Okay.
Yeah. Yeah, I feel like they're gonna be like more inspired. No, I'm just trying to look at it. I brought you my mask. No, because I would say that too. I was there.
But then we couldn't really
Okay, let's start.
Wait, give me 1 second.
No, this is water.
I'm gonna leave my water down there. Hello? Amazing.
Hi everyone, we're gonna get started now, so I'll find our little air. Oh, the air is actually on. If anyone feels very warm, that it's warmer in this room than other rooms, just like try to tag one of us like walking around. We did request the air and I still like the ducting on, but yeah, working with the temperature. Feel free to space out if you need to.
Hi all. Thank you guys for joining us today. I am with Writers Against the War on Gaza. I'm co-chair of the Popular Education Committee, and it was an honor to work alongside MSJP to formulate Health is Political for you all today. When people think about the political, it's often tied to the spectacle of our government. In reality, Dr. Hussam Abu Safia being held as a hostage by the Zionist entity is political. A teen dying because of inability to afford an inhaler is political. Black movements being targeted and criminalized when they operate in service of their communities is political. Cutting Medicaid is political. Children dying of eradicated diseases is political. We cannot sidestep around the ways in which our health is held captive by the state. The evidence is vast, and in particular, obvious to those of us who live in neighborhoods that are ravaged by redlining and economic ceilings that have an impact on how our communities are funded. Public health studies have shown that this structural racism is a large factor in poor health outcomes for our people. The evidence is also apparent in Gaza, where a thriving healthcare infrastructure that was once the jewel of Palestine has been destroyed by US-funded weapons and by the Zionist entity, where doctors have had to make the impossible decision between deciding who to save, while their hospitals are besieged and bombarded, where they have to leave messages on the wall as they choose death over leaving their patients. One of these messages were found on the walls of Al-Shifa that read, "Whoever stays until the end will tell the story. We did what we could. Remember us." All of this is greenlit by the hands of Western corporate media, all of it political. The first segment of this event will concentrate on the political nature of health from a global health perspective. It will be led by Anurima Kumar, who is a public health worker who received her master's from Columbia, though denounces the institution. She is also an interdisciplinary artist based in Queens, working to build bridges between community, health, and justice. It will also be led by Mira Rothman, who is a researcher, writer, and poet based in Brooklyn. They earned their master's in health policy planning and financing from the London School of Hygiene and Tropical Medicine. The second segment that you guys will take part in today is a teach-in titled, "What the Young Lords Teach Us About Resistance." And it'll be led by Jason Jackson, who is a medical student in St. Louis and an organizer with Medical Students for Justice in Palestine. It is impossible to not regard the mechanism that determines if we live or die, one that we are all a part of from birth, as political. I encourage you all throughout the two-part teach-in that will end on a visioning exercise to think about the ways in which this system has been political for you, and if it hasn't, in ways in which you can make it so. So with that being said, we'll be moving on to our first teach-in.
I think we have to move the mouse. Okay, I can start. Hi, everyone. I'm Mira.
I'm Anurima.
Thank you so much, Shay, for introducing us, and thank you to Writers Against the War on Gaza, specifically Vani, Evan, and Shay, for their thought partnership and work in making this event actually happen. And thank you so much to Medical Students for Justice for Palestine for collaborating with us and for your wisdom and expertise. And finally, thank you all for being here on a Saturday in the middle of the day and giving your time to learn, share, and be in this space with us to talk about health. On the screen is an image, we can go back, from November of 2023. You may remember it. It's a group of Palestinian children holding their own press conference outside of the Al-Shifa hospital. They're speaking in English, addressing the Western world, which is responsible for the genocide, and addressing us, viewers, watching through the screen on our phones. The boy in the middle who has the paper says, "We want medicine, food, and education. We want to live as the other children live." These basic desires for medicine, food, education, the right to health, the right to live safely and freely on your land are going to be the premise of our talk today. A lot of times there's this conception of health and doctors as this like insulated field that is somehow immune from social and environmental forces. But today, and in this first part of the talk that Anu and I are going to be giving, we're going to talk about how health is inextricably political. Anu and I met a little over a year ago in an organizing space for Palestine, and we bonded over the fact that we had gotten our master's in public health, but we didn't really know what to do next. And we were trying to figure out, like, what does public health mean? Like, what is it? And we were going around and around and like naming different things. And we kind of came to the conclusion that public health is everything. It's bound up in everything we do. And ultimately, it's a lens for viewing social problems and for viewing the world. When I think about the future of public health, I think it's a lens for viewing our communities with a focus on taking care of one another and protecting each other. So in this presentation, this first part, do you have the clicker? We're going to start by overviewing what is health, maybe more than what I just said, which is that health is everything. And then we'll talk about social determinants of health in Palestine. And finally, we'll talk about the relationship between American medical system and imperialism before we hear from Jason. So I'll pass it to Anu.
So we're going to start quite broadly on what is health. And I want everybody to kind of ground yourself before this presentation and before all this information on what is your own definition of health. This can mean illness, being free of illness, being in community with others. So just take a second, 10 seconds we can just take to come up with your own definition. So this quote on the screen is from the Alma Ata Declaration, which was created during an international conference on primary health care in 1978. And this conference was aimed to address global health disparities and a need for equitable and accessible healthcare. And this declaration also emphasized a primary healthcare plan and a goal for a health for all by the year 2000, which is 25 years ago. So this conference also affirmed that health is not just the absence of disease. It's also a complete physical, mental, and social well-being, and that this is a fundamental right to every human to achieve the highest possible well-being of health. And this quote is especially interesting because an acceptable level of health for all the people of the world by year 2000 can be attained through a fuller and better use of the world's resources, a considerable part of which is now spent on armaments and military conflicts. So this is entirely helpful in informing why health is political, in that it is acknowledged that so much is being expended on military, on all this surveillance, on policing, when it really should be invested in people's health. So this will provide us with a framework for what's next, which is the social determinants of health, which is a pretty wordy concept, but is something that affects every person in this room, every person in the world, in which the social determinants of health are the conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. So these social determinants include healthcare and quality, neighborhood and built environment, social and community context, economic stability, and education across and quality. So again, this can be where you grew up, it can be affecting you where you age, it can be affecting your older life, your younger life, and just where you're born, even if you moved from there. So we're gonna do a quick exercise where we're just going to turn to the person next to you or behind you, make sure everybody has someone, and just think about which social determinant of health has impacted you the most. How has your neighborhood, access to health and education impacted you and your outcomes? And what would be different if those looked differently? And all people interact with these concepts. It's not just healthcare workers or experts or people who have studied the field. We are all impacted by the social determinants of health. So we're going to take like 2 minutes to kind of share with the person next to you. And I'll just pull up this. Well, I guess you can look at this one, but just kind of pick one and discuss how it has affected you or the people around you. Okay, 1 more minute, and then if you want to share out, I'm going to call in someone. Good? Nice. Okay, everybody, we're going to come back together, finish up your thoughts. Is there anybody who is willing to share something that they heard from somebody else? Anybody? Anybody want to share something that they discussed? quickly go for it.
So we talked about a couple of neighborhoods, Astoria, Harlem, and Upper West. So for Astoria, we talked about how, the subway stations don't have elevators. So that's really difficult for people to access if they can't walk up the stairs and go to the station. There's also a lot of access to fresh markets around the particular neighborhood that we're in. So that makes it really easy to eat seasonally and have nutritious, affordable meals compared to other neighborhoods, such as Harlem, where, there's a lot of bodegas around, because two of us work in Harlem, and we see that there's not a lot of access to fresh, nutritious, affordable food, but just a 10-minute walk away to Upper West. You see that everywhere. There's a lot of hospitals and, more resources for health.
Thank you for sharing. In the nature of time, I'm not going to ask for another, but if you do want to share out later, there's going to be a Q&A and a visioning session. So just note your thoughts down and we'll be happy to share it then. So after this, I'm going to pass it off to Mira to talk about Palestine and how these social determinants of health relate to Palestine.
Do you just press this one? Okay, perfect. All right, so now we're going to put our focus towards Palestine with this understanding of social determinants of health. So since October 7th, 2023, Israel has killed over 60,000 Palestinians, according to Gaza Health Ministry assessments. Within the first month of the genocide, doctors coined a new term in their documents, WCNSF. Does anybody know what that means? Exactly, wounded child, no surviving family. The scale of atrocity has been unimaginable. Now, in March of 2025, Israel and Hamas are moving into the second stage of ceasefire deals, which Israel is actively breaking. Since the first ceasefire agreement, Israel has killed over 118 Palestinians. But as part of this deal, Hamas is releasing 33 Israelis in return for approximately 2,000 Palestinian prisoners that have been held in Israeli detention. Many of them have been imprisoned for decades. They were first taken as teenagers and are now being released as old men and women. Al Jazeera has reported that many people are being returned with clear and obvious signs of torture, limbs removed, and severe injuries from Israeli torture and detention. And so this is just a reminder of what we all know, which is that this is not new at all. This has been going on for over 75 years. And the effects of Israel's occupation and control over Palestine for this long period of time are really based in a health crisis and a deterioration of all of the social determinants of health and a targeting of them in Palestine. So we're going to return to this article that Anu and I wrote in 2023 called Occupation is a Public Health Crisis Too, and examine how the occupation has affected public health in literally every aspect of life in Palestine. All right, the first one is herbicide. Herbicide is formed from two words, herb, which means city, and side, which means death. So quite literally the death of a city. It is intentional destruction as a tactic of control. Because of Israel's ongoing bombings in Gaza over decades, people in Gaza are constantly stuck in a cycle of destruction and rebuilding. And Israel even places restrictions on Palestinians' ability to rebuild. They say that Palestinians cannot purchase cement, and they've even barred Israel from selling cement to Gaza. So all of the new infrastructure in Gaza has been built off of recycled rubble. And here's a picture of Gaza after the Israeli siege in 2008. So this was like 20 years ago. From a public health perspective, long-term destruction of the physical environment results in a feeling of impermanence and a loss of a sense of place and identity. It's not just spaces that are being destroyed, but it's social and cultural networks, people's schools, people's libraries, people's homes, people's histories and historical artifacts. And all of that is so detrimental to people's well-being. Gaza is also one of the most densely overpopulated areas in the world, in large part because people don't have the ability to leave. It's the largest open air prison. And overcrowding contributes to numerous health issues such as cancer, chronic obstructive pulmonary disease, cardiovascular disease, and asthma. For children specifically, not having space in the home leads to lower cognitive development, poor respiratory health, and high blood pressure. And as Anu was talking about earlier, it's like even if people move, these are things that like ingrain themselves in the body. So all of these sources of trauma and this like lived trauma lives through you no matter where you go. All right, next is a scarcity of food and water. So this is a map from 2005, and you can see that everything around Gaza is red, which means it's a no-go zone, and Palestinians are not allowed to enter. 30% of Gaza's farmland is in this no-go zone, so they're not allowed to enter their own farmland. I don't know if anybody's seen the film Foragers, but in this film, there's a scene where the interviewee is talking, and the interviewer thinks that she's talking about dealing drugs because she's talking about like something covert that she has to do to get things. But she's really just talking about harvesting za'atar from land in Gaza that she's not even allowed to access. More than 42% of land that is cultivatable has been destroyed by Israel, which commits herbicidal warfare, which is a tactic of clearing agricultural land by spraying crop-killing herbicides. Most iconically, between 2000 and 2008, 112,000 olive trees were destroyed by Israel. And this is like a sign of Palestinian life, and Israel continues to target olive trees as well as other means of Palestinians' ability to get food and water. This map shows all of the restrictions on Palestinian food that are even allowed to enter Gaza. Baby formula is restricted. Chocolate, it's considered a luxury good. Fresh meat and cattle. The only produce that's allowed in is produce that's near or post expiry, based on overproduction in Israel. In addition to blockading food and water, Israel also blockades electricity in Gaza. In 2017, Israeli blockades limited electricity in Gaza to only 2 to 4 hours per day, which is probably unimaginable for most of us. But in Gaza, people for decades have had to structure their entire days around 2 to 4 hours, doing all their laundry, charging their phones, doing their work tasks, all around these 2 to 4 hours, which are sometimes subject to change. The electricity will come on in the middle of the night, and then people will wake up and start doing their laundry. From a medical perspective, this also leads to countless preventable deaths. This makes life nearly impossible for people who need electricity around the clock to live. Kidney patients who are hooked up to dialysis machines frequently have their treatment completely interrupted when Israel turns the power off. This can cause blood clots and fatal blood shortages. Other people with lung diseases require nebulizers to breathe. This is a photo of Riham Bahithi, who is a woman in Gaza who shared her story of how her son was born with a congenital lung disease and required a nebulizer to give him the oxygen to live. She talked about one time when the electricity went out and her son couldn't breathe. She rushed him to the hospital, but the hospital did not have electricity either. And so she just brought him home. But her house, which was built out of corrugated iron, got hot and stuffy, and he wasn't able to breathe there either. So she took him outside of the house and fanned him with a fan so that he could breathe. And this was 9 years ago. This was in 2017. So this just speaks to how structurally Israel has targeted every aspect of life in Palestine and made it as impossible as they could for people to live. And I'm going to pass it to Anu now.
Next, we'll talk about mental health in Gaza and also in Palestine, where this concept of PTSD is not real because it involves post, and there is no post yet. Israel, for the last 75 years, has caused an ongoing mental health crisis. And this is a piece by Malik Matar called "When Family is the Only Shelter" that she made after sheltering with her family during Israel's bombings in 2021. After this these bombings, a study found out that 9 out of 10 children in Gaza suffered some form of conflict-related trauma. And 9 out of 10 is an insanely high number that is also probably underreported. The research has also shown that adverse childhood experiences, which are so linked to your social determinants of health and your experiences in formative ages, affect children's health for their entire lives. So like we've been saying this over and over, these are things that you carry for your whole life. And it affects brain development, immune systems, stress response systems, and even the ability to learn. And over 2/3 of all people of Gaza are registered with a refugee status, which means they have no country that they're legally tied to. And being a refugee has been shown to have high rates of PTSD. Even this concept, like I mentioned, is not even sufficient for what people are experiencing. The head of Palestine's mental health services called it a Western concept to say PTSD, because it's for people who can leave and there's an end to the trauma, there is recovery, there is care. But to the bombings and to the effects of Israeli occupation, these do not end, and they are still not ending. And there's a separate type of diagnosis now for this type of trauma, which is called continuous trauma stress, or CTS, which is when the trauma is repeated and ongoing throughout people's entire lives. So just another grounding slide, that amidst multiple health crises and an ongoing genocide and a continuous long history of resistance, Palestinians teach us about what it means to care for health and for your community, and to truly embody an ethic of community, of love, and a willingness to sacrifice life for your people and their land. We can be inspired by that. And Mira is going to highlight a couple of people who were killed by Israel in the last year, but we want to remember their stories and their work and show it as an example of how we can be advocates for health.
The first person we want to highlight is Khaled Naben, who became known globally for the image of him cradling his granddaughter Reem, who was martyred by Israel. And he said that she was the soul of his soul. I can remember when that image was posted, and I think it just like broke so many people. After Reem was killed, as he himself was grieving, Naben helped rescuers and medics take care of injured Palestinians, and particularly children. On the right is a photo of him in the year after she was killed, in the hospital, volunteering and caring for his community. He fed animals that were starving. He helped people who had been left with nothing. And in the words of his son, he became a one-man relief agency. The next person is Dr. Hammam Alo, who was a 36-year-old nephrologist who worked at Al-Shifa Hospital. As Israel launched ceaseless attacks on the hospital, Dr. Alo refused to leave. He said in this interview with Democracy Now!, "You think I went to medical school and for my postgraduate degrees for a total of 14 years so I could think only about my life and not my patients. I'm asking you, ma'am, do you think this is the reason I went to medical school, to think only about my life? This is not the reason why I became a doctor." Finally, this is Yusuf Abu Rabi, who is a 24-year-old farmer who fled his home in North Gaza when Israeli bombing began. When he returned and found his home and his farm completely destroyed, he went with his family through the remains of the vegetables and picked out the seeds that were remaining in the bombed crops. And he planted those new seeds. He grew eggplant and jute and revived his family's land and fed his people and helped them fight the starvation that they were facing.
So all of this comes down to a relationship between the American medical system and imperialism, and it might seem like a jump right now to look globally and then come back here, but this next part of our talk will go into examples of how the American medical system and American imperialism has actually controlled a lot of what is going on in the global south and the rest of the world as well. So we're going to start with talking about the AMA, the American Medical Association, which was founded in 1847 with the idea to standardize medical education and practice. And by 1870, so it kind of enshrined this perspective by voting a majority of issues about racial and gender discrimination that were not of a nature to require any action. So kind of a medical neutrality approach it had adopted. And what this means is race and gender issues were sidelined, and eventually this has resulted in courses in public health, preventative care, and indigenous health concepts to also not be prioritized. And something notable is that the AMA has commissioned the controversial Flexner Report, which is a survey of the U.S. medical education that aimed to highlight the science of the medical profession. But it argued that Black doctors needed good schools rather than many schools. And this led to actually the closure of 5 out of 7 medical institutions that were serving mostly or teaching mostly Black students. And this has directly created a shortage of Black physicians today, and that exists to this day as well. And this goes into the AMA's silence and neutrality towards Palestine and towards other issues that are anti-imperialist. This tradition of medical neutrality kind of leads to a peace resolution. So the AMA released a statement about Palestine and Israel that stated that both parties involved in the conflict must respect the principles of medical neutrality during times of armed conflict. However, the AMA also provided millions of dollars to Ukrainian healthcare, but has still remained silent on all of the health crises in Gaza. From here, we can also directly look at American imperialism in our day-to-day lives with the social determinants of health. And we're not going to look at every single social determinant of health, but specifically we're going to take a look at neighborhood and built environment and also health and healthcare access. So built environment is a really good example of American imperialism and priorities. Housing in the US is not a right for all. It's unaffordable. It can be overcrowded. It can be unsafe depending on where you grow up, where you're ending up. Housing is a right in New York is through law, through the Callahan studies. However, we know that just because it's a right doesn't mean it's prioritized. It doesn't mean it's accessible, and doesn't mean it's caring for people around it. Redlining was a discriminatory practice of denying services to residents of neighborhoods based on their race or ethnicity. And this included denying mortgages, denying financial loans and insurances. And it kind of also led to communities adopting like a holier than thou approach. So if there was a Black family trying to enter a mostly white neighborhood, they would do other ways, like not legal ways, more of like social concept ways of not allowing them to enter. And this redlining has actually led to a disinvestment of communities of color today. And this is still present today as well. It leads to a lower life expectancy. It leads to increased risk of diabetes and other chronic health issues and other chronic long-term health issues. And it has also led to an underdevelopment of these areas like green spaces and parks and gardens, which are providing physical opportunities for young people, older people, also reducing heat island effects, while fostering community engagement. So we can see that like the impacts of these laws and these histories of built environment are still impacting our health today. I put this slide up here just to help us imagine, like despite all of this reality, we have such a power to imagine. And this artist, they're tagged up here, did this reconceptualization of like, what could our built environments look like? Like, what are we really dreaming for? And it really doesn't have to be this way. Like, what does it look like? What are your wildest dreams in terms of what your housing can look like and your neighborhood can look like? And I just encourage everyone to look at these images and keep it in mind for the visioning later, and we'll get a little bit deeper into those concepts. And then lastly, in terms of health and healthcare, the American medical system has a deep tie to imperialism. There's a prioritization of the military-industrial complex, policing, surveillance efforts like ICE, especially recently, that directly correlate to a lower investment in health and public health preventative efforts. Healthcare is a commodity, not a right here, and it prioritizes a profit with high insurance premiums, deductibles, and out-of-pocket costs. And all this to say is that public health is a field that is not good or bad, but we see examples of public health when imperialism is in power, how it can affect other people. So what could this look like if imperialism was not directing public health? So a notable example in the history of public health is the Tuskegee study, which occurred for 40 years almost in 1932 by the precursor of the CDC, which is called the Public Health Service, where these medical professionals intentionally withheld therapy against syphilis and infected around 400 to 700 people, Black men, in Tuskegee without their consent. They all believed that they were getting medical care, free medical care, and the nature of the study was to observe the natural history of untreated syphilis. Even though there was a cure and they did find the cure, they refused to give this cure to, or these treatments to these people. And this is a really hard study to like think about, especially if you are an advocate for people's health and you just understand that like, the history of the field is actually so dark sometimes and has led to so much distrust in the medical system. And to this day, there's still almost a 51% distrust in the medical system by young Black men and who are now not receiving care because they have this distrust because of examples that were provided to them. And it poses a lot of questions for like, how do we care for each other really and be truthful and honest? And all this to say is that this study was also taken to Guatemala for 2 years with the assistance of the local government there. And largely because prostitution was legal, they infected prostitutes with syphilis, again, without consent, and wanted to watch and manage the spread, did not offer any sort of treatment. And this study was kind of left behind. And in 2010, documents were brought to the light that demonstrated that these physicians had taken so much advantage of people and vulnerable members of society, such as those who were mentally ill, prisoners, indigenous people, those who were enrolled in the military. There's a concept of paternalism in public health where it's a concept that these medical professionals know better and can inflict policies on you to understand your bodies. And in this case, medical professionals were making decisions on behalf of their patients, assuming they knew better, just for the sake of doing these studies and because of this power imbalance. Eugenics has a huge history with public health. Public health movements supported sterilization. There was a pivotal case, Buck v. Bell, which basically allowed state-enforced sterilization, and almost 70,000 people were sterilized, all in the name of protecting this genetic superiority. It was informed by white supremacy, but it was basically an ultra-Darwinian view on keeping people who did not get sick, who did not demonstrate, things that were not seen by these people as good. Again, all to say is that whoever is steering the wheel of public health has a say in the impacts of the health of people, and that eugenic methods in this time were often modeled on infectious control techniques that we use today in epidemiology and to manage other public health techniques. And then I'll pass it to...
So while Tuskegee and eugenics example are from recent history, a modern day example of the crisis and the relationship between American medicine and imperialism is the Black infant and maternal mortality rates. Research has consistently shown that Black mothers and babies have the worst childbirth outcomes in the United States. But what this graph on the right does, and this is from the National Bureau of Economic Research, this study is very groundbreaking in that it divided up these mortality rates by race as well as by income. And what they found is that, as expected, higher income parents experienced lower rates of infant mortality. But this did not apply for Black women. In fact, the richest Black women still had infant mortality rates at about the same rate as the poorest white women. And this disparity applies to mothers as well. Data from 2023 showed that Black women in the US died at a rate of nearly 3.5 times higher than white women around the time of childbirth. And the reason for this is multifold, but one very significant and direct one is that clinicians systematically dismiss Black women's pain. Black women share experiences of telling the doctors something's wrong, something feels off during childbirth, and the doctors just telling them to calm down and dismiss them. This is a persistent pattern that happens. Pain is something that is subjective. It's an experience that people feel, and therefore believing that someone is in pain is something that is subject to a doctor's prejudice. And often, and in the case of childbirth, that can mean life or death for people.
After looking at all these examples, I just wanted to provide an example of anti-imperialist healthcare, and we'll get a little bit deeper into Jason's presentation as well on more of these strategies. But there, in the beginning, the onset of the COVID-19 pandemic, it's really interesting to see Kerala, a state in India's response to COVID-19 compared to its surrounding states, which are all ruled by like the fascist party BJP. Kerala has a health model called the Kerala model, which emphasizes social development as at the expense of economic development, which is really interesting. There's a lot of government investment in health and education and a high rate of social mobilization, which is led by labor parties and popular movements. And this results in directly in improved living conditions for the poor. And there's an extremely proactive government response and a measure of the society's development using human well-being rather than GDP. So currently Kerala is criticized for having a low GDP, but their people are actually healthier and more educated because of this measurement. Kerala also had an extremely quick response to their initial cases of COVID-19, which involved directly hospitalizing and quarantining and actually making sure that they received the treatment necessary initially after the first two cases. And neighboring states actually weren't even able to contact the patients that were exhibiting symptoms of COVID-19. Kerala also has delivered free food to doorsteps and organized community kitchens. And this photo on the right demonstrates a food package that was given to every household for a period of time. And it includes any essential food that could be needed, including flour, chili powders included, dal, so you have your protein, you have your nutrition. And in the left-hand image, we see the cases in Kerala compared to the rest of India, which is a little covered, but the top line, the yellow line, is the India cases. So again, it's just an interesting example. We can also delve deeper into Cuba and universal healthcare and look at a lot of examples that way.
One final example of the relationship between Western health efforts and imperialism is Western health efforts abroad. So I'm going to highlight an article by Mary Turfa, who is a writer and surgical resident, called Doctors Without Politics. This article is amazing. I would recommend that everyone write this down and honestly read it. But she talks about Doctors Without Borders, which is a humanitarian organization that provides a lot of life-saving work to people in crises, to people under genocide, to people under conflict. They have done a lot of amazing work, but in order to do the work they do, which is often entering these highly politicized zones, and in Palestine, working alongside Palestinian doctors and nurses to treat people who are injured, they need Israeli permission. And so that puts them in a difficult position because their entire presence in Palestine is dependent on Israel. And so because of that, they maintain an ethic of refusal where they just abstain from politics, which is a little weird, and that's what she talks about in the article. They denounce killings and the loss of life, but they refuse to take a side. So even as they're saving and trying to help all of these patients who are being directly killed by Israel, they don't take a side at all and don't denounce Israel. And Turfa understands this and acknowledges the complexity of these doctors' position, but she also speaks to the futility and the impossibility of neutrality amidst imperialism, and also how frustrating it is for doctors who were born and raised in Gaza who are doing the same work and not receiving any of the same recognition as humanitarian aid doctors who are coming in. And the way that people grieve for humanitarian aid workers' lives versus the way that people grieve for Gazan doctors who didn't have a choice, but who stayed. Dr. Alo, the one I gave an example of, who stayed, who refused to leave, who treated their patients. There's a disparity in the way that we talk about them, and that is a direct result of these lenses of power and imperialism. This quote is very long, but I was just really moved by it, so I want to read a little bit of it. Some of the foreign doctors who enter Palestine perform the role of old school humanitarians, without allegiances except to an abstracted thing called life. Quickly, these doctors realize they have nothing as doctors to stop the bombs, and their witness, when facing those poised with the professionalism that accommodates genocide, emphasizes bodies over people. It is incomplete. Realizing this, there are doctors who reach for something more. The Palestinian pharmacist, resistance fighter, and martyr Bassel al-Araj spoke of being Palestinian in the broad sense, meaning everyone who sees Palestine as a part of their struggle, regardless of their secondary identities. The orthopedic surgeon Sui Chai-ong first traveled to Beirut in 1982. Soon after, she founded Medical Aid for Palestinians. During MAP's early years, she required her volunteers to read Rosemary Sayeg's From Peasants to Revolutionaries. The doctors she sent to serve Palestinians should understand that they were serving Palestine. Otherwise, they should choose a different medical mission. All right. Finally, our takeaways. I want to return to this first concept. Health and access to quality healthcare are fundamental human rights. And in the visioning exercise later, Anu is going to walk us through how we can envision a world where that is actually possible. The examples we've shown today, I don't want them to make us cynical that like health is bad or healthcare is bad or it's never possible. It's about how these systems interact with systems of power. And as Anu said, another way is always possible. But in this presentation, we've looked at examples from our own lives, examples from Palestine, and examples from the history of American imperialism and how that has affected vulnerable communities in America and abroad, all of which demonstrate how deeply interconnected these systems of health and power are. Building a world where everybody has the right to healthcare, clean air, nutritious food, clean water, and safety will require us, as Turfa talks about in her article, to let go of these falsehoods of neutrality, which is just not possible. And finally, I'm really happy to see so many like healthcare workers and non-healthcare workers here today. I think we wanted to make sure that people understood that we all have a role to play in this. We are all involved in health as people who have bodies, and as people who work and exist within communities. So we all have a role to play in fighting for the future of healthcare. And we'll end with this idea that our liberation is bound together. Our emails, as well as the email of WAWAG's Pop Ed group, are up here. So we would love to connect with all of you after the presentation or later on.
So next we'll have Jason going into 5-minute break.
Yeah.
Okay, never mind. Do you want to do that?
Yeah, for sure. So we're going to take a little 5-minute break, and I wanted to let you guys know we are selling t-shirts. Well, MSJP students are selling t-shirts, and they are on the table towards the back. And to be transparent, the funds of this t-shirt are going to two places. One of them, 2/3 of the funds are going to Let Gaza Heal. And this is an initiative which is raising $40,000 to provide living stipends for as many as 200 Gazan medical students. And the other third is going directly towards someone's GoFundMe. So if you would like to check out the t-shirts and take a little 5-minute breather, and then we will head into the next segment of the teach-in.
There's not, and so there's just one trying to what do you do now?
Now we're looking at yeah. What do you guys want?
Research.
The next presentation is going to be
Also, like the article looks really good, but I feel like I need like to read it. Also, like, I think that the conversation about like political neutrality, especially I feel like they're just trying to like turn it into like, oh, so you're referring to political neutrality, so we shouldn't be servicing people.
I know.
And like that's not what we're saying.
I know.
So trying to like challenge that makes us start to yeah, for sure.
Okay, we're gonna get started again, everyone. We're gonna get started on the next section. Just a quick other update now that you guys are back. I wanted to make sure that you knew that the latest edition of the War Crimes that we've produced with Writers Against the War on Gaza is available in the back. There's a hefty stack, and this basically encompasses a lot of what we're speaking about today. So make sure you grab yourself a copy or two. They're free, of course, as always, and you can find them on the table towards the back. All right, and the next section will be given by Jason, who will be talking about the Young Lords and resistance.
Hey y'all, can you hear me? Let's see. Thank you. And then are we? How's it going? Good. So like she said, I'm Jason. I'm with Medical Students for Justice in Palestine. I'm a med student in St. Louis. And so for the first half, we were talking about health being political inherently, right? And then they ended on this note of doctors without politics and how that's the issues with that, the problems with that, and even a note about like, we don't want this to be doom and gloom. And I think that that's important for us to actually have concrete examples of when this is happening, because a lot of people are like, yeah, like I understand this is important, but like that's not what med students do. And like you're right that like standing up for Palestine is not something that most medical students do, and it's definitely don't go out on a limb because of the repercussions in terms of not just getting kicked out, but also like the loans that we take on and all these kinds of things. But there are historical examples, right, of doctors and healthcare workers being political. And I was thinking about this, because I've been discouraged over and over and over again. All of us have, like, don't speak out, don't talk about this. You're going to be framed as anti-Semitic. You're going to be framed as this sort of thing. It's going to ruin your career. It's going to blacklist you. And also the number one thing we keep hearing and actually having our events censored on is don't be political. But like, I know the history of the Black Panthers, and I remember hearing that like they worked with medical students, and so I was like just curious about that, and we were reading about that, and I uncovered we did some research on the story, and it's quite insane, the parallels to today, and so that's what I'm going to be talking about today. Medical, so this is an article that we eventually published with Writers Against the War on Gaza, and in the New York War Crimes. So this is called the Lincoln Collective. So one of the things that we've noticed across the country is that we have a lot of sympathetic peers, but there's only, in every class, there's only a handful of people that are actually willing to speak out, put their necks out there, right? And this was the same situation in the late 70s, because I think it's just the conservatizing forces of the medical profession, right? It's like, even if you agree, it's like scary to speak out. And so they had the same problem. These were medical students that were part of like Students for a Democratic Society and all these kinds of things. And they actually decided that they were all going to match into the same residency. So a lot of them wanted to do pediatrics, and they figured, well, if we're just a few of us at every medical institution, we're not going to be able to do anything. But if we all are in the same residency, then maybe we can shake things up, basically. And so that's what this is. In the last academic year, some socially conscious or radical physicians, depending on one's point of view, at Einstein decided to use Lincoln to work for revolutionary changes in medical care. A national campaign was mounted to recruit pediatric interns and residents who were concerned with practicing medicine in such a way as to affect social change. The aim was to concentrate a critical mass, one of the guys was really into physics, of such people in one hospital so they could have a massive impact there. And this is a group of them looking, there's not a blinker, yeah. Oh, yeah, there is. Oh, but it's on TV. this is a group of the medical students at one of their conferences. So they didn't choose a big fancy hospital. They chose a community hospital in the South Bronx, Lincoln Hospital. Some of you might be familiar with the story of the Lincoln detox program. And they chose it because it was already being very politicized. So there were, I'm just gonna see if that's, anyway. So there were, takeovers all the time. Like I was noticing this as I was going through newspaper archives. Like we all know that like the Columbia encampment here was inspired by the 1968 one. That was like happening every Friday. Somebody was taking over a building. There were mental health care workers that took over the Lincoln Hospital multiple times. There were people that took over hospitals in Harlem. Like the conditions were intense. The Black Panthers were out there and they were agitating and they were helping people connect the connections between their oppression here and the war in Vietnam. And I just also think that like, people were mad. It's like rage is a condition of life in the South Bronx. It permeates the rubble-strewn streets and the unheated tenements. It blazes in the eyes of youth gang members and smolders in the brooding faces of mothers huddled on pre-dawn lines at welfare centers and stacked in rows of benches in hospital emergency rooms and clinics where many wait an entire day to see a physician. I've seen ER rooms like that today. So this is the Lincoln Pediatrics Collective. It wasn't like there wasn't the entire residency, which was kind of awkward. There was like maybe 12 of them that were international medical graduates, but the vast majority of them were coming from schools from all over the country, and they matched into Lincoln's pediatrics program. And this is one of the flyers that they put together, maybe drawn by one of their patients. And this was sort of like the advertisement for them for like, hey, like apply to this residency. We are going to be political, basically. And they actually quoted Frantz Fanon, in the colonial situation, going to see the doctor, the administrator, the constable, or the mayor are identical moves. The sense of alienation from colonial society and the mistrust of its authority are always accompanied by an almost mechanical sense of detachment and mistrust of even the things which are most positive and most profitable to the population. So like they were directly using, theory to say like there's a reason our patients don't trust us. It's because we are seen as endorsements of the system, and so in order for us to gain our patients' trust, we need to be refuting the system and being explicit about that and trying to get them involved in their own care. So they were pushing for community control of the programs, having parents that were actually on the board deciding who the residents were going to be, having higher firepower. They wanted community control, and at first, so this was Lincoln Hospital, was out of Einstein College of Medicine. They were cool with it. They were like, that sounds really good. And also they were like, well, we can bring you med students from all over the place, and not international medical grad students, which is a whole other thing. But it's like seen as prestigious to have American graduate students, medical students, or residents rather. And so they were like Lincoln Hospital, and even the director of this program at the beginning was like, oh, that sounds cool, getting the community involved. Yeah, but they like kind of went over that word of like control. Like the community should be in control of their healthcare. And so that becomes a point of tension later on. And this is actually, this is what they meant. So this is, I mentioned the Young Lords Hospital takeover. So the Lincoln Collective started residency July 1st, 1970. And the Young Lords, and they did not know this, or they at least say they didn't know this, that this was going to be happening. They occupy, the Young Lords, are the like the Black Panthers. They were inspired by the Black Panthers. They were the like Puerto Rican militant group, socialists, and amazing. And they actually worked with the Black Panthers on this. They also worked with healthcare workers, but the doctors, they didn't know them yet. But as soon as they found out about it, they were like, oh yeah, this is exactly why we're here. Let's lock in. And so. Sorry, one second. Let me go to this. So this is a picture of a doctor climbing through the window here, and immediately they were like, what do you guys need? Like, we support you. We're going to help you guys get your demands basically for the community. The doctors gave them white coats so that they could just kind of walk out the front door. And so like there was one person that got arrested, but also because the community, it wasn't even a de-arrest, it was just the assumption that if somebody gets arrested, they're going to have more occupations, because again, there's so many of them happening that they just let them go. So nobody was like officially charged for this. It was a 12-hour takeover. And this is sort of a broader pattern that the Black Panthers and the Young Lords were doing, is they were doing these takeovers not just to gain power for their communities. They were also doing it to demonstrate how all of these issues are connected together, and they were using it as like education. So in all of these, they're talking about who's profiting from this hospital. It's also the people that are profiting from the war in Vietnam, right? And so here's like medical services in this country have always had profit as a prime concern. Additionally, an imperialist mentality has infected all medical facilities. In Chicago, it is known that Cook County Hospital practices genocide. So this is a pamphlet from Chicago from the Black Panthers, by sterilizing thousands of black and brown mothers immediately after they give birth. Pigs are stationed at all city hospitals, their purpose being the protection of private property and arresting people that look quote-unquote suspect. Hospitals are among the largest of the land-grabbing institutions, humanistically content to displace people in order to build facilities to further butcher people. So they were using it to like show the contradiction, showing like reproductive health care and how it's racialized. They were talking about profit-driven health care. They were talking about gentrification all the way back then, like talking about like these hospitals are displacing these communities they're claiming to serve. And so they called them butcher shops, basically. Hospitals are imperialist butcher shops. And that became like the official name of Lincoln Hospital, but I think it was used earlier by the Black Panthers. Because you go there to get butchered, basically. They didn't trust it. There's an imperialist mentality. So, like I said at the beginning, it was, Lincoln was all on board and Einstein was all on board. However, after the Young Lords takeover and they sort of realized that the residents, like, oh wait, you supported that? Like you're for that? And they're like, yeah, not only that, but we're doubling down on that. You need to get them their demands, basically. That's when tensions started to get very high. And so the residency director was a physician by the name of Dr. Arnold Einhorn. And he said that, the way that it was framed is, the views on the Panthers differed, which is definitely true. I told them we could not cooperate with racist groups, so he's calling the Black Panther Party racist. But then he started to realize that the collective, it was then that he began to view the collective with misgivings. I could see the handwriting on the wall, he added. So he starts seeing that like the doctors, the community, everybody has surrounded him. He doesn't like the Black Panthers, but everybody else does, basically. He also was trying to say that they don't have support of the community, that they were sort of fringe, but I think he asked to be basically relocated somewhere else because he just realized that there was a lot of tension. Also, the doctors were like not going for hierarchy, and like in medicine, if you watch like medical TV shows, like going against your attending is a big deal, and they were just like doing rounds without him, and that was making him really mad. Anyway, so eventually they decided to he decided to leave. And at the same time, they had a job application from a 41-year-old pediatrician, Dr. Helen Rodriguez. She was a pediatrician with impeccable professional credentials and a personality that indicated she could get along with the pediatrics collective. So this is from Charlotte Phillips. I've heard that she's one of the leaders of the Lincoln Collective. I've heard she's like in New York still doing stuff with healthcare workers for Palestine. But this was her interpretation of the situation. I got this from an interview a few years ago. Our connection to the Black Panther Party led to the sequence of events culminating in the resignation of Dr. Arnold Einhorn, chair of pediatrics at Lincoln. He was replaced by Dr. Helen Rodriguez, a visionary leader who was able to go with the flow of our community-oriented program while shoring up our academic foundations. Helen subsequently became a national leader in the women's health reproductive rights movement, as well as other arenas, and served a term as national president of the American Public Health Association. So it was that Einhorn was not driving with the Panthers, but also that they had gotten this director that was, with the Young Lords, and she was clearly had the same vision, basically. Later on, so that takeover was in July. In November, there was another takeover, and this was by the South Bronx Drug Coalition. And so this was actually people who were suffering with addiction that were complaining about the lack of services. This was kind of the needle that broke the camel's back, so to speak. So like they were having all of these, sit-ins and all this kind of stuff. And I found a passage somewhere where one of the doctors is like, yeah, they came to us and they said, can we get access to the 6th floor? And they like hand them the keys. And so then like they like because of the Lincoln Collective, they basically took over and started their own drug program on the 6th floor of Lincoln Hospital. And this was when finally the city was like, sure, okay, you could have your drug program. Basically, this was like early November. And this turned into the Lincoln Detox program. And so I don't know if y'all are familiar with this, but this was a community-run drug program. So it was in order to oppose the methadone clinics, which they saw as sort of numbing people, keeping them addicted, and also just sort of numbing them to the the impacts of capitalism. And so they instead did acupuncture, which they had gotten from a trip to China, and they had like exchanged with different brigades in China, and they also did political education. So they were framing it as like, they did education on the ways that the British used opium to conquer the Chinese, right? It's like by basically selling them lots of drugs, getting that population addicted, that was how they basically conquered. And also talking about how the government is doing the same thing here, CIA putting crack in black communities through the Iran-Contra affair. And it gave them a sense of agency, the patients in the program, and also they gave them pathways into into membership into the Black Panther Party. And so it was like giving them agency and something to do. It's a totally different way of thinking about detoxing. So this went on for almost a decade, basically. And this was only possible because of basically the Lincoln Hospital was afraid to fire all of these residents because they had all unified and filed into this residency. And then they were working with local community groups who said, this is what we want. And then the patients wanted it, the workers wanted it, the only people who didn't want it was the admin and the police, basically. But then they had to concede. Of course, a week after that sit-in, there was sort of a counter response to it. And so the Jewish Defense League is I say because they're still around today, a right-wing organization. They were staging sit-ins of Einstein, the dean of Einstein's office, calling them anti-Semitic for dismissing Einhorn, even though he was the one that kind of said he wanted to go. But there was a memo that he had sort of worded the language of it as a political or ethnic disagreement. And so basically, so all of a sudden, not only do you have the people sitting in the dean's office, you also have the New York Times, the New York Post, all backing it up, calling them anti-Semitic, and kind of going with this, and then also framing it as like this is a natural consequence of getting involved in the ghetto. So the political traps, these developments are being watched closely by medical schools throughout the country, which are under pressure to get similarly involved with medical care for the poor. The political booby traps that Einstein Medical College has encountered in the ghetto may cause others to hesitate about entering that arena. Moreover, the spread of social consciousness and radicalism among the nation's medical students and junior physicians suggests that developments at Lincoln presage analogous conflicts elsewhere in the medical system during the 1970s. And so they're even fear-mongering about what this could mean for your hospital, right? So they're saying like the radical, and it sounds very similar to what we hear today, right? The radical left is taking over, they're anti-Semitic, they're full of hate, and they're coming for you, basically. And there was a huge backlash. Einstein is a Jewish medical school. I mean, it was funded by Jewish donors. Most of the doctors in the Lincoln Collective were Jewish. And yet they're being smeared as anti-Semitic, basically. And they lose donors, they lose funding. The dean is hospitalized with stomach ulcers, and at one point, and then a year later, he actually gets dismissed. And they say it was over issues of financial control over the university and a chaotic environment, basically referencing the Lincoln Collective. So, and then there were people when the dean was dismissed that were saying basically, we need to focus more on research. Like we don't need to be getting involved in care of the poor. So this is Fitzmullen, who passed away just a few years ago. He was one of the leaders of the collective. I'm not going to read all of this, but basically he's talking about how they were portrayed. And at the end, he's like, there was all of this tension, and it was true. Like, they didn't like Einhorn at all. But it's like, and that, to those of us who knew the Lincoln situation well, was the most perplexing and disturbing question. Where had the issue of anti-Semitism come from? Who had publicized it, and why? This brings us to part 3, COINTELPRO. You guys familiar with COINTELPRO? Have you guys heard that before? What's COINTELPRO? Sorry. No, it's okay. If anybody like is counterintelligence program. So what were they doing?
It was the FBI's program to basically destabilize radical movements.
Yeah.
Black Panthers, the Young Lords, and they were basically doing different types of like propaganda or kind of like operations.
Yeah, exactly. Yeah, and I'm glad you said the propaganda part, because a lot of times when people think about COINTELPRO, they think about government surveillance, and they think about maybe the assassinations that happened, but a huge part of it was propaganda. A huge part of it was misinformation and lying to the media and getting the media to sort of, not that it took much for the New York Times, but getting them to run with a story. And so right around this time, 1967, you have the Six-Day War, basically. And there was a defeat for Palestinian forces, but there was also a rise in militancy and a rise of sort of the Palestinian like socialist left. And they had a huge international component. And so at that same time, the Black Panthers, the Young Lords, all of them, this is a picture from the Young Lords, their paper, and here's George Habash, they're saying liberty for Palestine. So they had it ingrained in their sort of ethos, basically, that they were pro-Palestine, they were there for the Palestinian resistance. And this started to spark fear, whether it was organic fear or whatever. The New York Times actually says, they started publishing these op-eds saying Jews fear anti-Zionism of the new left. And then this is an FBI memo showing that they saw this. And the FBI is not trying to verify whether or not this claim is true, but they note that Jewish communities are becoming more and more afraid that this anti-Zionism on the left is actually, they're saying it's anti-imperialism, that Israel is just a watchdog for the West, that's all just a cover, that actually it's hateful anti-Semitism. And they note that, and then they say we should be sending these articles to, the right people, basically. And so they were sending it to Jewish allies of the Panthers and trying to sort of stoke that. And it wasn't working because the Panthers were incredibly persuasive. And then, we'll move to, sorry, this is out of order. They decided that they had to actually, start agitating a little bit more. Earlier, I brought up the Jewish Defense League. This was, again, a right-wing Zionist organization fighting for Jewish rights. They kind of stylized themselves like the Panthers, but they're like the opposite. So Rabbi Meir Kahane, he was also an FBI informant. He had infiltrated communist organizations for over a decade. And he was the founder of the Jewish Defense League. He was very critical of he was the one that started the sit-ins, and he was very critical, obviously, of it. And so he was saying, this is one of the first examples of the mention of reverse bigotry. So he's saying that we need to let merit guide and not race, that this is, reverse bigotry. We can't allow it to happen. The New York Times basically defended Kahane's sort of framing, saying, they had this editorial, does the efficacy of a penicillin injection depend upon the skin color of the physician who administers it? Is the correctness of a diagnosis dependent upon the nationality, ethnic origin, or religion of the doctor who makes it? So they're saying this is a race thing. And you're wondering, I'm bringing up COINTELPRO, I'm bringing up JDL, how does this kind of tie together? The FBI actually fabricated letters to him they acknowledge that he already knew what the Black Panthers were about, and he wasn't really mad at them. Not that he couldn't have been provoked easily, right? But then they actually falsified this letter, pretending to be a World War II veteran, a Black World War II veteran, whose son had just joined the Panthers, and him and his friends were over last night, and they were saying all sorts of anti-Semitic stuff. And Rabbi Kahane, I just want you to know, this is a bad situation, right? So the FBI is deliberately making completely false letters and sending that to Rabbi Kahane. who then starts to go on a tirade, and his entire focus becomes disrupting the Black Panthers and the Young Lords all throughout New York, Brooklyn, and the Bronx, especially, and Harlem. This is how he framed the actual hospital sit-in. A few hospitals had a more dedicated and warm staff that, working under terribly difficult budgetary conditions, brought superb care to the poor residents of the neighborhood. Nevertheless, spurred on by Puerto Rican militants, demands were made for community control of the hospital on the grounds of quote-unquote racist neglect of the needs of the community. The real desire of the militants was that Puerto Ricans and blacks be placed in control of the hospital and Jews be pushed out. And he actually, this is, I won't go into it, but he actually had a relationship with Dr. Einhorn, a very close one. And so you're wondering, like, all of a sudden they win they gain power basically with getting this detox program, and a week later there's this national media campaign coordinated calling them anti-Semitism out of nowhere, and you can kind of connect the dots that this was FBI led basically. And this is another quote from Dr. Phillips, and I don't know that she is aware of, I know she's aware of COINTELPRO. I don't know if she's aware of this specific, that it was like Rabbi Khanna was actually an FBI informant, but this is, continuing. The New York City fiscal crisis of 1975 and the austerity regime that followed led to budget cutbacks, which made the provision of care even more difficult. At the same time, the COINTELPRO program decimated the leadership of the Black Panthers and the Young Lords. I'm not sure we were aware of that at the time, but in retrospect, it seems very clear that that is what took place. So, and I won't read the rest of this quote, but, and I can send the slides later, but so they were kind of wondering, they kind of understood that COINTELPRO might be a part of this, but it in fact was, it was staged by basically, or coordinated, I would say, by the FBI. Also, the doctors that were with the Lincoln Detox program, the one of the main allopathic doctors was found dead in a closet, shooting up, and he had no sign of drug use whatsoever, and just the way that the body was found, people were like, that's very suspicious. They framed it again as obviously an unsuccessful attempt to destroy the Lincoln Detox program. Eventually they did destroy it. Dr. Mutulu Shakur was one of the Black Panthers that was running it, and he, I'm pretty sure he died in prison. He was in prison for decades for a number of things. But this was the government's response, basically. So you want your own health care, this is what we're gonna do to you. And I bring this up because this is also, Fred Hampton was the sort of ringleader of bringing together the Black Panthers, the Young Lords, the Rainbow Coalition. He got young white, rebels together, is what they called themselves. He was unifying gangs, rival gangs, to join the Panthers. And he was shot and killed December 4th, 1969, laying next to his pregnant wife. And so, the government, the COINTELPRO, they're very deliberately talking about how can we drive this wedge between the communities? How can we make the Black Panthers seem as though they actually hate white people, that they're a racist hate group, as they were going toward the sort of multiracial coalition, the socialist movement. And so this brings us to our last part, which is just, what does this mean today, right? Because we would be naive. They say they retired COINTELPRO, but come on, right? They renamed it or something, like the CIA did with the USAID, right? And I've already started to talk about it, but what are some of the forces happening, here today? We have, the nascent or resurgent Palestine movement. We have White Coats for Black Lives, which 4 years ago, every university, every med school on earth was it was during Trump's presidency, they're we support, White Coats for Black Lives. They're using that hashtag. White Coats for Black Lives says we're continuing the Black radical tradition, right? We have always supported the struggle for Palestinian liberation, and they were smeared as anti-Semitic. There was somebody who says, I was a DEI director. DEI drives campus anti-Semitism. And she directly says, how would a Jewish patient ever trust a medical trainee or professional who subscribes to such blatant anti-Semitic hatred? For saying they support Palestinian liberation, it wasn't even support the Palestinian resistance, it was Palestinian struggles or the Palestinian people is anti-Semitic. And I'm saying this to a room full of people who probably are already very well aware of the sort of stuff that goes on. This is a tweet from Professor Rupamaria from UCSF, talking about the presence of Zionism in the U.S., which, if you understand Zionism for what it is, as this settler colonial ideology, holding it, being proud of a settler colonial ideology while taking care of Arab patients, is that not a contradiction of interest, or conflict of interest? That's what she was asking. And this is still up today on UCSF's website, decrying this as anti-Semitic, saying both Jewish and non-Jewish people see the use of the word Zionist and this debunked narrative as an anti-Semitic attack. It is morally reprehensible as it is intellectually bankrupt, nothing more than a repackaging of an old racist trope that UCSF renounces. They say, we will continue to encourage open dialogue, even on the most difficult and painful topics, but we cross the line. Both Jewish and non-Jewish people, everybody believes that that's anti-Semitic. It's like, they're saying that their idea is basically normative, and you cannot question this. This is a line you cannot cross. And we've seen it over and over again. You're not allowed to cross this line of denouncing Zionism. And I'm doing it on a YouTube webinar right now. But let's be, as we're doing it, let's talk about what Zionism is. I always feel like I want it, because people think it means Jewish. No, this is one of the founders of Israel, one of the first prime ministers, and you can just take their words for it. We have forgotten that we have not come to an empty land to inherit it, but we have come to conquer a country from people inhabiting it that governs it by the virtue of its language and savage culture. I mean, there's so many examples of this, right? I'm preaching to the choir, but because it's on a public webinar, let's just be clear what Zionism is, and what this ideology is about. It's about the elimination of the Palestinian people. It is not about Jewish self-determination. And the natural consequence of this is that you have people who are committed to that ideology. And so this is Baruch Goldstein. He actually, a decade after all this Einstein sort of situation happened, he was a physician that graduated from Einstein College of Medicine. He committed the Cave of Patriarchs massacre, going into a mosque in Palestine and killing people, killing Palestinians. And before he had even gotten to that point, he was well known for denying care to Arab patients. That was something he prided himself on, and I don't know, I can't even stay on the slide for too long. Healer and militant killer chose violence. Gunman and doctor who often refused to treat Arabs was an extremist whose views had only hardened. And I asked, an extremist, yes, but if Zionism is predicated upon the elimination of Palestinian people, then is he just not following what the founders of Israel had said, right? It's taking it to its logical conclusion, basically. This is, and so you can compare that to Dr. Abu Safia. I don't think he has not been released yet, right? They said it was going to be today. That's why I asked. Of course, they said this, right? Compare this to what Dr. Abu Safia's peers said about him. He told me one time that he will provide the same care to an injured Israeli soldier similar to a Palestinian child who ended up in his hospital. He's the essence of being a physician and humanitarian, and he deserves to have the Nobel Peace Prize, not to be detained and injured. This is the natural, the logical conclusion of Palestinian liberation, of anti-colonial medicine, of anti-colonial belief systems, right? Is you produce doctors like this. And just sort of to end on notes of what other medical schools could do, is kind of a little bit out of order. But thinking about a lot of people can't, in the beginning I was talking about how you can't imagine this isn't something that medical students do. Well, that's not something that medical students do in the U.S., right? Speaking out for Palestine. But there's this wonderful example of Cuba, and there's many other countries, but this is a picture of it's called the Elam School of Medicine, International Latin American School of Medicine. They have 10,000 doctors. It's the largest med school in the world. They're training them for free from all over the global south, 122 countries, including 400 Palestinian medical students. this is a picture of the dean wearing a keffiyeh in her Facebook profile picture, which like I cannot fathom. And then this is a solidarity encampment that the administration helped and published on their social media and everything like that, in solidarity when we were all doing our student encampments, basically. So again, when people tell you that, you know, this is just isn't something medical students do, it's like not here and not yet is how I envision it, right? And then sort of ending on this idea of all of our struggles being connected, because I'm often, you know, asked like, why is it that I'm going all out on a limb on Palestine? I mean, not often, but like, you know, it's like, you know, I have friends who are involved in other activities and they're like, I just don't have time or whatever. And I'm like, look, like, yeah, first of all, what's happened is atrocious and it should stop all of us in our tracks. But also, like, this is for the survival of my community too, as a Black person, right? And like, I have internalized that and I understand that like, and this is quoting one of my friends, that everything I do for Palestine, I do for Black people too, right? Because this story shows that all of these myths, the Zionism, racism, anti-communism, these are all interwoven into the same thing. We are all fighting the same thing. It's the same people saying the same stuff about the same people, right? And so, if you just allow this to be normalized, these obvious contradictions, then you're just pushing off the liberation of your own people. And so this is an interview that we had, and we mentioned we're selling these t-shirts back here actually, so there's 2/3 are going to Let Gaza Heal, which is 200 medical students who have been displaced from Gaza. And then the last one is going to Hind, who is a Gazan medical student who's been, you might have seen her, I'm trying to think of her last name. She's published in Mondowise and Al Jazeera. She helped us design the t-shirts actually. And anyway, so this is one of the students that we've been talking to with Let Gaza Heal, and we were having a conversation just about Black Palestinian solidarity. And what blows my mind is they know more about this history than your average American, actually. They know about Angela Davis, the Black Panthers, all of that, because it left an impact on them and because they're informed on it, unlike, you know, Americans. Anyway, I'll end with this quote from our friend. He said, you know, we are medical students. We speak sometimes 2 or 3 languages. We are all civilized people who fight for our freedom, who don't want to harm other people, who believe in humanity, who believe in different religions and the freedom of all people. It is really bothering everything that has happened to Black people, to Palestinians, and to all people who hope for their freedom. It is just something so painful. But we will keep fighting for our freedom. We will keep fighting for our dignity, for our right to live, for our right to have our own country, for our right to have these things just like others, just like human beings. That's it. That's all we need. So thank you. Are we going to take a 5-minute break? No. Straight into visioning. Okay, cool.
Thank you, Jason. I hope everybody's been marinating in all the information. It's a lot of information, and we'll work on somehow sharing all the content with you all. We're going to move straight into the visioning to not keep too much time here. We have 2 large questions that have come from both topics, large amount of topics. And what we're going to do is we're going to split up, and we're going to basically produce an output based on Faith Ringgold's example. Faith Ringgold is a quilting artist, fabric artist, painter who passed away recently. And she's known for these story quilts where she tells stories on these giant quilts, and they're composed of all these different imageries and all these kinds of quotes. This one is called Dancing on the George Washington Bridge, 1988, which has always been fond for me because I used to live up there and right near this bridge. And so I fell in love with this piece. Go back, actually. So what we're going to do is we're going to discuss these questions in these groups, and then somehow no pressure on the output, but you have markers, you'll have colored pencils, all these materials to just scribble out your answers and be inspired by what you want to see in the future and see immediately tomorrow, today. So the question number 1 is, how is your community's health tied to the health of Palestinians and the rest of the international community? question number 2 is, how can you defend health as a human right? And feel free to come up and ask questions during this. I think the easiest way will be to group by section, and then we'll just pass out our materials for you, and there's extra space, and we'll give this about 25 minutes, correct? 25-ish? Do you want to count out? Shay, we have a suggestion to count off because to do 1, 2, 3, 4.
Want to count out? Or just you could go ahead.
Yeah, we're going to count off. So we're going to do 5 groups. 5, and I'm going to give you a number, so just pay attention real quick.